Louisiana's executive budget proposed a $10 million cut in funding for neonatal intensive care units that treat our state's most medically fragile infants. The Louisiana Hospital Association recently visited with House Speaker Pro Temp Walt to discuss his efforts to restore this funding.
Unfortunately, this year in the executive budget, the governor's plan suggested $500 million in cuts to patient services and hospitals across the state of Louisiana. One of the more troubling aspects of those cuts was a $10 million reduction to the NICU programs across the state of Louisiana, leaving vulnerable our sickest and most fragile infants across the state. And so I think many of the legislators, including myself, are very pleased that the House Appropriations Committee was able to successfully get an amendment restoring the cuts to the NICU units across the state. That $10 million will be available to fund the most fragile infants across our state, all over our state, and ensure that our medical providers and hospitals, from the biggest city to the smallest town, provide access to these infants when they're born, and provide them with innovative technologies and life-saving treatments. And so we're going to continue to monitor this as we move forward. As we continue to restore healthcare cuts across the board, we're going to remain very vigilant in ensuring that the NICUs across the state are fully funded, and we restore these devastating cuts. And so, long way to go in this process, but we're excited about the opportunity to help support care and access to care for these needy infants.